What are the underlying root causes that lead to the blood vessel dysfunction? Simply asking your patient to stick out their tongue and put their tongue, because if your blood vessels are too constricted and your heart is choking against every single heartbeat.
Hi, everybody. Welcome to the Kidney Coach YouTube channel. I'm naturopathic Dr. Fiona Chin, co-founder of the Kidney Disease Solution and head formulator at Hygenesis. And I am so thrilled today to be joined by the amazing Dr. Ellie Campbell. So let's dive in. So let's talk about this oral hygiene. And of course, people listening are going to have kidney disease, but as we know, cardiovascular disease is the second leading cause of kidney disease and changes in kidney function. And sometimes we have patients where you can do everything left, right, and center, and you can't quite get the blood pressure where it needs to be. Or it sounds like if you're not really treating this driver, you're still going to have changes in blood vessel health and endothelial health. So let's dive in.
What is plaque, right? Well, we have two kinds of plaque. We have plaque on our teeth.
Mm-hmm.
We have plaque in our blood vessels. Plaque in the blood vessels begin to make the blood vessels smaller so that more force is required with every heartbeat. Obviously, that's going to raise your blood pressure and increase your risk for events. Most of the plaque is formed behind the drywall, in the wall of the muscle of the artery, not where the blood flows. It's in the wall of the artery. 90% forms there. And then a plaque will rupture, cause a little blip of cholesterol to get in the bloodstream. The body doesn't like it. It aggressively forms a blood clot over the surface of that cholesterol oozing into the bloodstream. Right. The blood clot is what causes the sudden event. If it's a small enough blood clot, it's going to seal off that oozing cholesterol like a scab. Mm-hmm. Smooth muscle cells are going to infiltrate, calcium's going to infiltrate, and you'll get a little speed bump in the blood vessel that can be seen on an ultrasound test or on an angiogram as a plaque. Mm-hmm. If the blood clot is large enough, it will actually occlude the vessel, causing a sudden event, such as D-stroke or a heart attack. If you can get to the hospital quickly enough, and you have the right kind of stroke or heart attack, they can give you clot-busting drugs to burst open that blood clot and restore blood flow. And that can be a miracle, magic eraser to stop that event. Not every stroke and heart attack is eligible, but this is why we need to call 911 and get to the emergency facility as quickly as possible in the hopes of saving whatever organ was damaged. But the plaque is often formed by this corrupted cholesterol getting behind the drywall. Mm-hmm. One of the bacteria that live in your mouth, called Porphyromonas gingivalis, it's an ugly bacteria. It's very mean. It makes all kinds of gene transfers to the other bacteria, sends signals to all the other guys to tell it to make a bloody mess out of your gums.
Yeah, right.
It causes periodontal disease or gum disease. Part of the reason why it makes all these signals to make a bloody mess out of your gums is because it eats blood as one of its favorite food. It's a nasty bacteria.
Yeah, right.
It wants to make sure it has plenty of fuel. Once it gets enough blood around, it now buries itself inside the red blood cells and can travel anywhere in the body wherever the blood cells go. Now you have Porphyromonas gingivalis mouth bacteria in your brain, in your arteries, in your kidneys, in your pancreas. Once it gets there, it has a nasty habit of secreting this goo called phosphorylated dihydroceramide. Phosphorylated dihydroceramide is a gooey cholesterol-like plaque. It makes its own plaque wherever it lands. It can make plaque in your brain, leading to Alzheimer's. It can make plaque in your carotid, leading to plaque there. It can make plaque in your coronary arteries. And it can even trigger this plaque rupture that leads to events. So I want to know if I have PG, Porphyromonas gingivalis, living in my mouth.
Yeah.
Because if I do, I want to go straight to my enlightened dentist and hygienist who will have a protocol to eradicate that bacteria out of my mouth. How will I know if I have it? Well, if I have a
Yep.
bloody mess in my mouth because I'm brushing and flossing and there's pink in the sink, there's a really good chance that I have it.
Okay.
So I'm going to march to my enlightened practitioner, and I'm going to ask for a salivary diagnostic test, a spit test, to look for these so-called red complex mouth bacteria.
Mm-hmm.
And if they find it, it's a DNA test, it comes back in a few days. If we find that you have any of these, and Porphyromonas gingivalis has other friends called AA, TD, TF, and FN, and they all live together in this ugly, bloody mouth colony. They're not good. They don't play nicely together. They play nicely for them, but not to the rest of our mouth bacteria. And the stronger that our friendly mouth bacteria are, the less of a chance that those guys have of setting up housekeeping.
Thank you for being part of our audience. And Dr. Campbell, thank you again for your wisdom, your time, and pioneering the way in just helping people live better, healthier lives.
You're so welcome. It's my honor.
All right, everybody. We'll see you next time. Thanks again. Bye.